For the first time, we got our hands on the FEMA model that predicts how many cases and deaths Arizona could see. It also appears to show Arizona has not met one of the gating criteria to reopen the state. ABC 15 reporter Nicole Grigg and data analyst Garrett Archer teaming up to go through the numbers to help you understand.
This is the model that the state has said for weeks is most realistic, but they've been waiting for approval from FEMA to release it. Well, today, Arizona's top public health official posting it online. The FEMA report dated May 7th, giving us a first look into what the state is calling most realistic.
The data for the model is coming from two different places. The first, the actual data that's feeding into the model are the case numbers and death numbers and hospitalizations from the AZDHS. And the second place is the CDC releases modeling assumptions that you can use to power a model, and that's also what's powering this model.
This newly released FEMA model predicting by mid-June we would see 1,300 deaths, almost double where we are now.
You look at all of our cumulative curves, we are at about a 30-day growth in Arizona, and that would somewhat track with what they're saying.
The other Arizona-specific model from ASU goes farther out with predictions. While the two models agree through mid-June, ASU predicts deaths rising to nearly 3,000 by July 1st. Data analyst Garrett Archer looking at the two.
What ASU model's showing is a rise in deaths that comes after those 30 days. So the slope is the same for both models until after the FEMA model stops, and then the ASU model increases pretty dramatically at that point.
The FEMA model also predicting cases increasing, but they make it clear that this does not account for potential easing of mitigative measures going forward.
This particular FEMA model has already just taken into the account of the AZDHS data and is not trying to assume what would happen with any opening strategies.
And lumped in the report, this graph appears to show Arizona has not met a 14-day downward trajectory in hospitalizations. It even clearly says it has yet to see a prolonged period of decrease. This came out May 7th. Then 8 days later, the governor let his order expire, meaning this shows there was no 14-day trend for one of the gating criteria. Dr. Kara Christ went on in her blog saying that these are only predictions. Now, experts have said it will take about 2 weeks or so to really know the impact of Arizona's stay-at-home order expiring. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.